Hello, my name is Erin Giles, QI representative here at St. Joseph Medical Facility. Today's presentation will go over the Quality Improvement Project to try to tackle the problem of sacral pressure injury formation. The unit we will be implementing this project in is the SADU, or Surgery Admit Day Unit. So, what is the problem? Well, the problem is that there are too many postoperative patients forming sacral pressure wounds. One complication after surgery is pressure ulcer formation on the coccyx due to inactivity post-surgical intervention. According to the Centers for Medicare and Medicaid Services, St. Joseph Medical Center had 633 patients with unplanned hospital visits after hospital outpatient surgeries. And a study by Mortada et al. Found that the incidence of developing a pressure ulcer after surgery is 54.8%. Major surgery also increased the risk of deeper pressure ulcers. Pressure ulcers can cause the patient's pain, increase the risk of infection, and even progress to death. According to the Agency for Healthcare Research and Quality, each year in the United States, 60,000 deaths out of 2.5 million hospitalized patients have resulted from complications related to pressure ulcers. Another issue is the cost for these pressure wounds. According to Badula and Delamente, the United States spends approximately $3.3 to $11 billion annually on hospital-acquired pressure injuries, or HAPIes. Just a single HAPI could cost a hospital anywhere between $3,000 and $70,000 or more. Hospitals also get less reimbursement from Medicare and Medicaid for these HAPIes. The ultimate goal of this project is to decrease the development of post-surgical sacral pressure wounds by 40%, and this will be done by applying a Mepilex sacral pad prior to surgery in the SADU by September 30th, 2023. By applying a Mepilex protective sacral pad to all surgical patients in the SADU, the number of patients returning to the hospital after surgery for a pressure ulcer could be reduced. This preventative step should be done in the SADU since this is the last area the patient will be before going to the operating room. Here is a timeline of the project schedule. This will be about 3 months long from baseline collection to the results of the implementation. So baseline data and collection, we'll go over week 1 through 3. And the collection will be from the St. Joseph Medical System regarding the prevalence of sacral pressure wounds in post-surgical patients within the past 3 months. More specific information will also be collected, which will include the length of surgeries, pressure wound development and stages, infection development, length of patient stay, post-surgical readmissions, and hospital costs related to the wounds. This information will be compared with the total number of patients undergoing surgery who also passed through the SADU prior to surgery. The goal will be to have all the information collected within 3 weeks. 30 to 60 minutes will be dedicated to each shift to allow for data to be collected and organized. Maulinkel Healthcare US LLC, which makes the Mepilex border sacrum foam dressing, will be contacted and distribute the pads to the hospital at a discounted rate for bulk orders. Weeks 3 through 4, after the data is collected, it will be organized using Microsoft Excel and Word into visual graphs, tables, and explanations. This will then be created into 20-inch by 35-inch posters to be displayed on the updates board where the team huddles are conducted. These will be posted in the CDU, PACU, and OR breakout rooms so the entire unit is aware. The poster will also contain the following steps and the overall goal of the QI project. The staff, which includes nurses, CNAs, and all OR staff, will receive an email and a paper handout with the related information, including step-by-step instructions for applying a Mepilex sacral foam dressing. This will also give the staff a chance to think about the problem and the improvement project before it is implemented. Weeks 4 through 5, I will meet with the charge nurse 1 week before the team huddles to discuss the project. At this time, I will also supply the Mepilex dressings and demonstrate the proper use and application. Any questions regarding the project will be answered, so the charge nurse has a full understanding. I will also give her her input. I'll ask her for her input on the best way to incorporate this additional step into the preoperative checklist. The EPIC system, which is our EMR, will be contacted to add the Mepilex dressing application to the checklist tab in the preoperative checklist so it does not get missed. Then week 5, I will join the team huddle and introduce the project, change, and the goal. I plan to make frequent references to the data and pictures during the meeting. I will ask for the staff to give honest feedback about the project. I'll also ask them what their concerns may be and if they need and what they need to answer patients' questions regarding the pads. During the team huddle, the charge nurse, Melanie, will then demonstrate on a mannequin the proper application of the dressing and answer questions from the nurses and CNAs. We will provide videos and pictures about the Mepilex application and also pictures of some of the wounds that are developed, of course excluding patient information. But this way the nurses get a visual of the seriousness of the problem. We'll also incorporate data from Wang et al. That states that the Mepilex sacral foam dressing has many benefits to prevent sacral pressure ulcers. Some examples are that they reduce friction between the skin and the bedsheet in ulcer-prone parts and can also improve the local blood and oxygen supply to the area. We'll also include the amount of money that pressure ulcers end up costing the patients and the hospitals, and how it can affect the other units with extended stays or readmissions. And we'll also include how this eventually affects the nursing staff and how it can relate to problems in several units, including when we need to transfer a PACU patient up to the floor and there's no available beds. And then we'll also ask the nurses to do a return demonstration to make sure the dressing is being properly applied. There will also be an education sheet given to the nurses, which includes information to be provided to the patients regarding the implementation of the Mepilex sacral pads. We'll suggest that the dressing be applied to the sacral area when the nurse is asking their patient about the integumentary system and they're checking for rashes or breaks in the skin before surgery. It could also be applied when the nurse is performing a lung assessment on the posterior lungs. Both are performed after the patient is changed into a hospital gown. The nurse should also document in the pre-op tab in the patient's chart that the Mepilex pad was applied. And then we will start to apply the Mepilex pads to all preoperative patients. This video will be provided to all the staff and nurses in those units, and it displays the steps for applying the Mepilex sacral pad. And again, this will be sent to all the staff in the CDU, PACU, and OR via email. Now, weeks 8 through 10, a simple survey will be provided for the nurses to fill out via email, and the link is included here. This will ask them 3 questions regarding the time it takes them to apply the dressing, how it affects their workflow, and the feedback that they received from the patients. The nurses will be asked to enter the survey results within 1 week, review the survey results, and discuss them with the charge nurse. I'll then meet with the nurses at the team huddle to check in and get feedback about the MEPILEX application. I'll thank them for their participation and bring in a box of donuts from Dockside Donuts in Tacoma. And we will continue to apply the MEPILEX sacrum foam dressing. Okay, week 18, the end data collection. The exact same data that was listed in step 1 will be collected for the past 3 months while the MEPILEX dressings were being applied, and the numbers will be compared to the data before implementing this change. The concluding information will be organized again using Microsoft Excel and Word. Posters will again be created and will include colorful graphs showing the prevalence of sacral pressure ulcers before the QI project was started compared to after the 3 months that the MEPILEX sacral foam dressings were applied. Additionally, a price analysis of the cost of a MEPILEX sacral dressing compared to the average cost of pressure ulcer formation. This will also include the length of hospital stay. And these posters will be put up in the update boards in the CIDU, PACU, and OR break rooms. A follow-up email will also be sent to all the staff within the department. All right, and so finally, the nurses who applied the MEPILEX dressings will receive an email and also a $20 Starbucks gift card thanking them for their participation. And if this project is proven successful, it will be proposed to the board of directors to make a permanent change. I just want to thank you for the opportunity to present this project. And hopefully with this new implementation, we can make a positive impact on our patients and company. Thank you.